Hi everyone, I'm Dr. Robin Berzin, the founder and CEO of Parsley Health, and I am here today for our weekly Instagram Live that we are hosting every single week at Parsley Health with myself and Dr. Kerri Masutto, one of our physicians in San Francisco, so that we can answer your questions around COVID-19 and around your health and wellness, and so that we can help you stay informed with the latest information that we're sharing from our physicians. So I am going to bring in Dr. Masutto now. All right, here she is. Dr. Masutto is joining, and we have a number of questions that were submitted to us from last week's live, as well as from over the week. And so we're going to be answering some of those questions today. Hi, Dr. Masutto. How are you?
Hi,
Here
Robin.
she is from San Francisco. I'm here in New York. You are seeing people, my office slash bedroom slash workout room slash place I hide from my children. This is where I'm at right now. And so I'm really excited to share the information that we have with you today. So first of all, I just want to acknowledge that this is an incredibly hectic and challenging time for everyone, as I did last week. And there's a lot of information out there, and some of it's legit and some of it's not. And so we're here to give you vetted, trusted information. And if there's one message that we can send this week, it is really to stay calm and stay informed, because information is changing literally every single day. We have an internal COVID task force at Parsley that's vetting information daily, updating our protocols, making sure that all of our Parsley members across the country have the latest information through their doctors, that we're all on the same page. This is a ton of work, but it's incredibly critical. The stats are flying. We're starting to see really high rates of transmission in New York City and in New York State in general. Also, as testing here has increased, we're learning more. There's also a lot of potential for our healthcare system to become overwhelmed, and we really like covidactnow.org. Again, that's covidactnow.org for some of the latest stats and figures. But today we're going to jump right into some of your questions. And so I just want to first remind, for all of you who don't know, I'm Dr. Robin Berzin. I'm the founder and CEO of Parsley. I'm a physician. I trained at Columbia and Mount Sinai Hospital in New York City. And Dr. Masutto, do you want to share a bit about you and your background?
Yeah, I'm a board certified internal medicine, primary care doc, lots of training in functional medicine through the Institute for Functional Medicine, and did my training out in Chicago, University of Illinois, Chicago.
Awesome. And again, one of our Parsley docs based in San Francisco. Okay, so we're going to go right into your questions today. And as you guys, some of you are submitting questions already. We're going to do our best to get to those at the end. We're going to roll through some of the things that you've been asking us all week. So the first one is around pregnancy. I've received a lot of messages around COVID and pregnancy, issues around delivery. And the question is, are there higher risks of birth defects like in Zika? The answer is no, not that we know of. Now, there have been very few pregnant women with known confirmed coronavirus to give birth thus far, so the research right now is really limited. However, to what we know so far, we do not see yet any issues with pregnancy. We do know that in general in pregnancy, you have a higher risk of having more severe colds and flus because of changes to your immune system, and your overall fluid volume status in your body is higher. So that may be the same. You may be at risk of higher risk of more severe disease in pregnancy. However, thus far, pregnancy has not been designated as a high risk category. And if you are pregnant and worried about COVID, or just have questions on healthy pregnancy in general, just remember, we do a lot of fertility support at Parsley Health, as well as pregnancy support. And you can join right now at Parsley Health. You get your first month free with the code BeWell on our website. And we're seeing patients across the country 100% virtually. So just a reminder on that. Our next question today is thoughts on ashwagandha, adaptogens, and supplements for anxiety right now. So Dr. Masutto, I'd love you to share our position on those things.
Yeah, definitely. So one thing really important to remember before you jump into using a lot of different supplements is that you know what your levels are on things like magnesium and vitamin D, because low levels of those can really make your anxiety worse and can be very easily supplemented. with a little bit of magnesium glycinate, which is something that a lot of people are deficient in, and really helps to calm the nervous system, helps you sleep at night, relaxes your muscles. And so something like that, very simple supplement, can actually have a big impact, especially if you're already low in it. And then for things like adaptogens, you really want to make sure that you are using the kind of adaptogen that you actually need. So things like ashwagandha really help with stress management and some hormone balance. Rhodiola is great for if you are actually fatigued or depressed feeling. It's very energizing. And then there's several mushrooms like chaga and cordyceps that can help with immunity and with your energy levels. So there's a bunch of different things that you can use. Now, obviously, supplements are one small piece of helping all the anxiety that we're feeling right now. But they can be a really effective piece if you know how to kind of work with the right one.
Yeah, and so adaptogens, by the way, everyone, are not a treatment for, or they're not immunity boosting. They're not a treatment for COVID. It's really important that there's a lot of supplement malarkey out there, as I would call it right now. And these adaptogenic supplements can be really helpful with stress management and hormone balancing. If you're already using them for that, that's great, but are not something to treat or support immunity for COVID-19. Now, that said, we are recommending supplements like vitamin D, and then magnesium is a great one. Again, not specifically for COVID, but just for stress management in general. I take 200 to 400 milligrams at bedtime. It really helps me have a deeper sleep. Okay. So our friends at Providence Meals just wrote in and said, reminded us cacao is a good way to get magnesium. Yes, dark chocolate can be a source of magnesium. So if you need to give yourself a treat right now, that's probably a good one. Okay, so tips and tricks for allergies. And I am seeing your questions, by the way, folks out there. So please know that I will be getting to them as soon as I can. People ask about allergies because we are also in allergy season as we end our flu season. And so there are a couple of ways to help with seasonal allergies, which are going to happen regardless if we're all staying at home. So air purifier at home, especially in the bedroom, doing a neti pot or a sinus rinse can be really helpful. And then there's some supplements like quercetin and stinging nettles that I really like, that if taken regularly at the right doses, and your Parsley doctor can actually give you the right doses for these things, but quercetin and nettles can be really helpful for dampening seasonal allergy symptoms. Now, of course, everyone who sneezes or coughs right now immediately freaks out and wonders if they have the coronavirus. And so we have a great article in our library on cold, flu, or coronavirus, and parsleyhealth.com/COVID-19 has all of these articles, but I'll review for you here in case you haven't done your reading. The typical symptoms of a cold are stuffy nose, sore throat, sneezing, sometimes a cough, sometimes fatigue, but with a cold, fever and headaches are usually pretty rare if it's just a true cold. And symptoms really only last a couple days with a cold, and after a week, you're better. With the flu, the original like influenza that we're used to, it's a very abrupt onset. In 2 to 3 days, you're feeling pretty bad with fevers, chills, cough, sore throat, runny nose, body aches, headaches, fatigue. You may also have digestive symptoms with the flu, although that's more common in kids than adults. And usually you start to be able to feel better by about day 5 to 7. Even if you don't feel completely normal by week 2, it's really those first 5 days that are the worst, typically with the flu. With allergies, you're getting symptoms like itching, rashes, swelling, maybe some shortness of breath, especially if you have a history of asthma, which are very allergy specific. And then with COVID specifically, fever, cough, and shortness of breath are the hallmark symptoms. Other hallmark symptoms are diarrhea or digestive issues in the early days, although that's a minority of people. I had someone I know write me on Instagram and DM me and say, I have diarrhea and I just got back from traveling. I have no other symptoms. I must have COVID, because they saw like an article somewhere, and I looked at the actual data set and it was like 7 out of 204 people in this small study, only presented with diarrhea. So it's unlikely that diarrhea would be your only presenting symptom with COVID, though right now anything's possible. And we are seeing a lot of reports of loss of smell and loss of taste. And by the way, the sensation of loss of taste is actually, your taste is biologically determined by your ability to smell. So you may be experiencing loss of smell, loss of taste. And then the hallmark with COVID is actually it's worse the second week. So you may be feeling symptoms the first week, And unlike the flu, which is much better week 2, typically COVID is worse week 2. Okay, and I'm seeing your messages and we'll definitely get to them. Okay, so emotional eating while in lockdown mode was a question we received from somebody. Dr. Masutto, tell us what we do to not eat ourselves through our cabinets at this time.
Yeah, well, the first thing to recognize is that changing in your eating patterns during a stressful time is totally normal. And so this is definitely the time to be easy on ourselves when we're coping with something like this rather than feeling bad about it. So what you really want to start to do though is look and see what your own emotional triggers are. I have a lot of people that have told me that after they like read the news, they feel like the need to kind of self-soothe, or you have a particular family member that is like really in panic mode and they put you in panic mode. And so you tend to emotionally eat after that. So recognizing some of those things can help you to just find other coping mechanisms when you're interacting there. But something to otherwise to realize is that if you're not sleeping well, if you're not exercising, if you're not doing other things that help to release your stress and reduce it, you will reach for foods that will just make you feel better. So working on all of those things, figuring out what your triggers are, making sure that the good for you food is really easy and accessible. So the candy is put away and not sitting out. You know, all of those things are going to help you. And then making sure that you're really having good, nutritious meals so that you're cutting down on snacking in between. But it's not easy. It's not easy for me. I know that if I have that candy sitting out in between meetings, I'll just like wander into the kitchen to eat it mindlessly. We're all in that situation. So being easy on yourself, but kind of setting up your kitchen and your system so that it's not quite as accessible can certainly help.
Yeah, I mean, we've never all been working from home with our snack bar, like literally a fingertips away, unless you work at Google, in which case you're probably the expert at this because you've been facing this challenge for like 10 years. But, you know, finding a way to deal with your emotions that's productive and constructive. So, you know, there's a great app called the 10% Happier meditation app. Ziva Online from our friends. Ziva Mind is great. I just sent that out to our Parsley team. Our members at Parsley get perks. So parsleyhealth.com/perks has all the membership perks that you get, which is a lot of great discounts on meditation, yoga, etc. I finally got myself to do some yoga online, which was hard for me, but I did it and I enjoyed it. Okay, so the next question we have is, you have adrenal fatigue. Are you at higher risk? So there's no science on having adrenal fatigue and necessarily being at higher risk of this infection or any other infection. However, if you are the type of person who, and I will do a whole spiel on adrenal fatigue and what that actually is another time, because there's a whole bunch of variants of it. But a lot of us are wired and tired, or stressed and tired in our daily lives and have elevated baseline cortisol levels throughout the day. We should all have high cortisol levels in the morning that come down over the course of the day and let us sleep. And a lot of people who are under chronic stress have high cortisol levels in the afternoons and evenings when they really shouldn't, which can interrupt sleep. If you're the kind of person who does like cardio and you're just flat wiped out, exhausted, this could be a sign that this is you. And so there's a lot of different types of adrenal fatigue, and we actually have at-home saliva and urine testing for this. So if you're not sure if this is you and you're home right now, this is a great time to work with us or whoever your doctor is to get some of this at-home cortisol or urine testing to evaluate your cortisol levels, at-home saliva testing or urine testing. But some of the things you can do to help balance cortisol, balance adrenal right now are yoga, walking, stretching, some of the more mild exercise habits, and some of the adaptogens that we talked about earlier, like ashwagandha, can help with that. And then ultimately, it's so critical right now to prioritize sleep, because if you are not sleeping well and sleeping quality, you will have a depressed immune system or a suppressed immune system. Okay? Someone who would love us to do an adrenal live. So, okay, we will take that into consideration because a lot of people have questions on adrenal health, and it is a really good one. Okay, so talk to me, Dr. Masutto, about pets and produce. A lot of people have been writing in, can we spread COVID through pets and produce? What should they know?
Yeah. So talking about just spreading COVID on surfaces, what we do know is that COVID can live, or coronavirus can live on surfaces for quite a long time. Copper, it's about 4 hours, which copper is very antimicrobial. So it's kind of the lowest amount of time. Cardboard, so cardboard boxes actually like 24 hours, and that even includes like your mail, paper, and 2 to 3 days on plastic or stainless steel.
Okay.
So when thinking about, is there a risk of transmission of COVID from these surfaces? In theory, yes. But we don't have a lot of evidence to show that there's actually been transmission from that. Because you have to realize the amount of virus that is actually on that surface that you would come into contact with, and then you would have to kind of directly apply it to your face and nose and mouth, which is why it's so important that we don't touch our face after touching kind of anything. Right now, it's very low, but there are things that we can do to kind of just minimize the risk. And that's really, when you get things delivered, because I know a lot of us, especially if you're in a more metropolitan area, you're getting a lot of your supplies delivered to you. Just leaving your cardboard box sitting outside and opening it up quickly and getting everything out from inside of it and leaving that box outside and washing your hands right away afterwards. It's just something super simple that you can do. Making sure that you're, after touching doorknobs out in public, those kinds of places that can really have a lot of bacteria on them, not touching your face, washing your hands right away afterwards. And then in terms of produce, because now we're even worried, like getting something from the store, could that have it on it? Same kind of thing. It's possible, but we really just want to be taking the same sorts of precautions we would be using on produce normally, which is washing it in warm water. One good thing that we have found from the CDC is that the virus is kind of deactivated, called denatured, like the proteins are sort of unbound when they're in warm water. So even just warm water, scrubbing your produce, or letting it sit in warm water. It's also a great time to use the same advice that I give when people travel, which is baked, boiled, or peeled. And that's going to be able to prevent kind of coming into a lot of contact with the surface that could have the virus on it. Yeah. So simple things like that. And then in terms of pets, we don't have any. We have one case from Hong Kong that a dog got sick, which I know all of us dog lovers were like, oh no. But it was one case. We don't have any evidence that can be any transmission to people. I'm personally practicing and recommending, like my dog gets social distancing too. I'm not letting strangers rub his head all over when we are out in walks because we're trying to stay away. And I wouldn't be able to stop myself from giving forehead kisses to my puppy. So those simple kinds of things without going overboard, I think are very reasonable during this time.
Yeah, absolutely. So yes, not known that pets can spread to humans. They cannot, which is as far as we know, which is great. But just taking proper precautions and staying home, right? And then just one thing I noticed in our recommendations here, there's no need to like wash all your produce in bleach or in toxic chemicals. We do not recommend that. Not even to necessarily wash them with soap. Just really wash your. My husband went on a grocery run yesterday, and before I could stop him, wiped down all of our vegetables and fruits with bleach wipes, which, while delightful and caring in theory, was not exactly what we needed to do based on this live today. And if only he had seen this first, right? So.
Warm water, guys, warm water.
Warm water. But the things that will kill or denature coronavirus are soap and water. Bleach solution will work. Hydrogen peroxide will work, and at least 70% concentration alcohol will work. But soap and water is really the number one thing. Someone asked, will refrigeration inactivate the virus? And the answer is no. Hence, a lot of the lab samples are being shipped cold. Or transmitted cold, and are we're still able to find the virus and so forth, so active. So it's not, so refrigeration will not do it, nor will freezing, to our knowledge. So it's really the things that I just listed. What else? Someone is writing in, if they have ulcerative colitis and are immunosuppressed, are they at higher risk? So I want to just clarify the difference between risk of acquiring the virus and risk of having a severe case. Because I think sometimes what I'm hearing, people are kind of morphing these two together, right? We are all at risk of acquisition, of acquiring the virus, and hence we're recommending that everyone stay home. And that is really our strongest message today, is be healthy at home, right? Your health didn't stop in its tracks when this all happened. You still have your underlying health issues, whether they're blood sugar problems, which do make you more at high risk, cortisol imbalances that could suppress your immune system or lead to blood sugar problems, things like smoking, heart disease, lung disease, pre-existing lung disease, all of the things that we know make you at higher risk. When we say higher risk, we're talking about higher risk of severe illness, right? So all of us are at risk of acquiring this illness, which is why that social distancing and in the cases of us in New York and California, sheltering at home is so critical to stop the rapid transmission of the virus, right? Now, secondarily, who is at high risk of a severe case, what we're seeing now is that some of the early thinking from other countries that it was mainly older people or people over 60 that were at the highest risk of severe cases. We're now seeing severe cases in people 20 to 44 in this country, in New York as well. So, again, covidactnow.org for some of the latest data on that. But when it comes to underlying risk factors for a more severe case, not for acquiring it, but for a severe case, being immunocompromised, cancer, or on a immunosuppressive drug where your immune system cannot combat anything well, right? Not just this, is going to make you at higher risk of a severe case. Somebody else asked, is ingesting silver, colloidal silver, as a benefit? No. There's a lot of, again, supplement malarkey out there happening. Hoarding of unproven medications. We do not recommend this. We are very conservative in our supplement recommendations right now at Parsley Health. Things like vitamin D that do have really strong evidence for them. Vitamin D, most people are low or deficient in vitamin D in this country. Like the vast, vast majority do not have a vitamin D level of over 40 or 50, which is really optimal. So there's a difference between being deficient and being optimal. Somewhere over 40 and close to 50 is really optimal vitamin D levels. Just barely hitting a level of 30 or 32, depending on your lab, is not is not ideal, right? So a lot of people are low in vitamin D, and vitamin D can be really helpful. Certain herbals can be helpful for prevention if taken regularly. And we do recommend some of those supplements, but by and large, there's a lot of things out there around things like oregano for this virus that are not true, colloidal silver that we're not recommending. Can you recommend supplements for getting your taste back if you have coronavirus? Somebody asked, no, your body just has to heal. And what we're seeing so far is people who have had the virus and recover are getting their sense of smell and taste back. Somebody asked here, this sort of pivots on your other question, Dr. Masutto, that you answered. Somebody asked if what if they have family members coming home from hospital, how should they protect people coming home who are healthcare workers, right, who have to go to work right now. And thank you to everyone on our front lines. If you have people who in your life, right, who can't work from home and need to be out and about, because that is a reality. Not everybody has the ability to work from home. What do you do to prevent transmission when you come home?
Yeah, it's the same sorts of things, making sure that you're washing your hands as soon as you get in the door before you're touching anything. If you have clothes that came into a lot of contact with surfaces when you're at work, changing out of those clothes right away, leaving your shoes outside or by the door that could track in stuff. Again, these aren't things that are really any different than we, have been doing. We're just going to be more mindful of not tracking in outside things. Anytime you touched an outside surface, you're going to be washing your hands or not touching your face. And something for like women with long hair, making sure that if you touch your hair during the day that you are shampooing and like more regularly and washing your hair in warm water before you go to bed, especially because it could in theory be there too. So some simple things like that, again, this is not like way different than normal things, just being more mindful to do them really regularly.
Right. Yeah, and I think that's fair. I mean, these are, take off your clothes outside, leave your shoes outside, wash your clothes every day, wash your hands when you get in, and reduce the risk of transmission that way. And if you are feeling symptomatic, you absolutely need to listen to that. I think all of us have been schooled in like ignoring our symptoms in life, right? Like we all kind of get taught, especially as doctors, and healthcare workers, but just in general, right? I feel a little under the weather. I'm just going to ignore that old feeling. And we don't want everyone to be overly sensitive to this, but we also want you to pay attention to your symptoms, pay attention to how you feel. And if you do feel like you have some of the hallmark symptoms, fever, cough, shortness of breath, maybe diarrhea, loss of taste, although usually rarely presenting alone as only symptoms for those, fatigue, that you listen to that and contact your healthcare provider, and that you immediately take precautions to, again, the people who are sick are the ones who should be in the community wearing the masks, and then healthcare providers out on the front lines. That you pay attention to that you take care of yourself. Somebody asked, what do we do if we do have coronavirus and we're sick at home? It is all of the things that we've been recommending to you and that we recommend for the recovery of any flu. Again, if you're feeling short of breath or having difficulty breathing, that is a sign that you may need intensive care, that you may need hospital treatment. But otherwise, if you are not having that, then you can recover at home. And we do recommend that people are recovering at home by staying hydrated, getting tons of rest, continuing to take that vitamin D and that vitamin C, and to, just in general, allow yourself to rest and recover, and do not go out in the community to spread the virus. Okay. Anything else that I haven't shared today, Dr. Masutto, that we should cover at the moment?
I don't think so. I think that was great and got through a lot of questions here.
We covered a lot.
Yeah,
we've covered a lot of ground. We will post this to our Instagram story, so you will be able to watch this video. Please keep sending us your questions. We're going to do this every week. If you want us to do this more often, we're happy to. We're just trying to get through the information that you're saying that you need our help with, so we're here for you. And most importantly, just giving you guys the most accurate information. We do have a new free guide up, which is our complete doctor written guide to COVID-19, which is all of these recommendations boiled down in one place. So get those. And if you're looking to work with us, the code Be Well for your first month free for our annual membership is still alive. So use that code Be Well, because you can work with us now across the country, work with our doctors, and telemedicine is the new normal for medicine. So working with us remotely is wonderful opportunity right now to take care of your health, and not just ask questions related to COVID-19, but just also questions about the rest of your health. Because remember, our health did not stop in its tracks when this all happened, and neither did we. So we are here for you. See you next week, if not sooner. And please stay safe, stay home, and be well, everyone.